a skilled facility and hospice.
I don't think he would be able to do the like physical therapy at this time because
Do
in
you mean just like a nursing home, or do you
Just
mean
a-
actually being skilled, like in
No,
rehab?
I mean in a nursing home.
Oh, okay.
well, it's a long-term nursing home.
Yes, we do that.
He can be on the hospice. I mean, even in the nursing home with or without hospice, there is no restriction to send him to the nursing home.
Okay, and does he get quality of care as a hospice patient?
I'm probably more eligible. I mean, you want to just ask him all the physician questions first, and then I can help
Is he
you with
gonna
that?
get better?
At this time, we cannot say anything, but the more chances are like not good. Like
Okay,
because
what's his kidney function percentage?
so let me let you know about these labs.
And the other thing was he's on NPO now.
Because he cannot swallow. If
He was
we
drinking water upstairs.
so
and he's laying-
yeah, so that happens. I mean, you never know.
Okay.
Condition may go down slowly, but if we give him something, it will trickle down to lungs. That will cause infection and aspiration. That can
Okay.
cause a breathing problem. That is likely he may choke from those.
Yeah, sure.
Okay, well, but he doesn't want a peg tube. So what's the option?
So peg tube in terms if patient is with the dementia, with the delirium, with the confusion, there are studies that shows like there is a not mortality benefit on after getting a peg tube. Okay.
He doesn't want a peg tube.
Yeah, that's what I'm saying. Even if we get it, there is no benefit of it. Even we will risk few more things. We will get the increase the risk of infection.
Yeah.
Other bleeding risk and other some other problems.
So at this point, just the IV nutrition that he's getting is all taken
Now,
care
would
of.
he get IV nutrition in hospice?
What do they give him in
No.
hospice? Nothing?
It's just for pain,
It-
it's just for
it's-
comfort, right?
It's for yeah,
It is,
in the
it's for-
hospice comfort, and they will make his symptoms better. So he does not he would not be in a pain.
Okay, well, I think pain is the number one situation with him. He doesn't like to be in pain, he doesn't want to be in pain.
Mm-hmm.
So if that's the case, am I looking at hospice or am I looking at,
Palliative care?
yeah. Is palliative care the same as nursing home care?
No. Do you have do you want to finish? Because I mean, it'll probably be 15
Yeah.
minutes for me to explain. So.
So his kidney numbers are 2.2. That is, I think, worse than 2 days back. It was 1.9, so it is getting worse day by day. It's not that severe that he needs a dialysis or anything. It has been stable in twos because it was 2.3 yesterday. It's 2.2 today. So almost I want to say there is a much change in the kidney number, but he has some kidney disease.
What level does he have to get to before he has to have dialysis?
I mean dialysis depending on multiple factors like symptoms, fatigue, and all this stuff, and the BUN that we call as urea.
Yeah.
If urea is elevated more than 80 or 90, then maybe qualify, and the creatinine 4, 5, and we see like if it is going up rapidly instead of slowly. Even if he has a 4 creatinine level, but is stable at that time, he does not need a dialysis.
So he's stable right now.
Yeah, I mean it's not that severe that he needs a dialysis. So other things are like electrolyte abnormalities that we see for dialysis,
Okay.
volume overload. So there are multiple things. We just don't check it at the creatinine level. We check it at the multiple things,
Okay.
at the whole picture
Okay.
instead of just at the creatinine level.
Is he in a position physically to go into hospice?
That she's gonna discuss with you about that. She will give you the information.
I mean, there has to be a level of physical.
Yeah,
He is
yeah.
eligible for
Yes.
hospice.
Yes.
See, yesterday, day before, they kept telling her she wasn't eligible.
No, he's not eligible for inpatient hospice.
In-house.
But
In
that's only a
house.
5-day thing, right?
Well, I mean, if you're inpatient hospice, it can sometimes extend past 5 days. We're not going to remove you from the hospital, but most oftentimes, if you're getting general inpatient hospice care, you're needing
Several days.
you're actively declining. You are getting continuous morphine, Ativan every hour.
And
If it
he's
could-
not getting that, is he?
He's getting it. I think he did not complain about it. There is an order for as needed.
Right. So it has to be, if your symptoms can't be controlled somewhere else, whether it's a nursing home or a home, then you can be put inpatient, but it's very, very strict criteria.
So if he goes into hospice and that is your part, what will they be giving his insulin? What are they giving?
Yes, ma'am. So they will, our medical director will look at the list of meds and figure out what it is he still needs versus what he doesn't need, like a cholesterol medication. We're not gonna
Yeah,
keep
yeah,
giving.
And that's
So
in the
they're
house
basically
hospice.
still trying to keep him
No.
alive.
Well, right now he's getting IV fluid, so he is, right. If he goes to a nursing home, most of that is foregone. Like, so you're basically saying, the definition of hospice is 6 months or less. But that doesn't mean that they pass away in 6 months. But our goal is to keep them comfortable, to keep them pain-free. Anything that is perpetuating and helping treat that diagnosis for which they were admitted is not treated usually. Like
Yes.
dialysis, if you choose hospice, we can maybe do dialysis like once or twice, but we have to de-escalate it just because that is prolonging the kidneys.
So what you're saying is, he really isn't skilled labor, he's more hospice.
I would say it's your decision to make him hospice or not, but I would say he's not appropriate for a skilled nursing facility or rehab. Because for that he has to do a physical therapy at least 1 to 4 hours, depending on the skills and the rehab. So that I
Okay.
don't think he would be able to do it.
And because he's not eating either, I mean, there's
No,
no
I mean, not
nutrition other than
eating and
nutrition.
he's
You have to see
confused.
improvement when you're in skilled.
Yeah.
I mean, if the only nutrition he's getting in is his bag, then, you know.
Mhm.
Okay, so what we've said is he's not gonna probably get better. So it's probably hospice that he would go to.
I mean, it is what I would do. The great thing about hospice is you're not married to it. So let's just say 2 weeks, we admit him once he gets to a nursing home facility, we admit him to hospice, and maybe y'all have second thoughts, and maybe his creatinine gets high enough to where maybe he needs dialysis. Y'all could then say, like, we want off of hospice, we want to start dialysis, let's do some palliative care, because you can do palliative care, which is a bridge between home health and hospice. So there's many, many choices, and no decision you make today or tomorrow are you married to.
So who follows him doctor-wise at the hospice?
It would be our medical directors. So
Your
Christus Hospice, and it's to Christus Highland.
So they just
Physicians.
provide a bed?
Well, so you get a room, you get the bed, you get all the stuff, and then you actually get twice the care. If you elect for hospice in a nursing home, all of the nursing staff still take care of you, and then our hospice nurses and aides come in as well. So you're actually getting
Okay.
more care.
Okay,
But then our medical directors are the ones that give the orders for the patient.
okay.
Do you need to go? I'm sure like you're.
Okay.
I think I've got what I needed from you.
Okay,
Thank
any
you.
other questions?
No, sir, not at this
We were
point.
just wanting to know where his medical situation is right now, 'cause we're.
Unless something miraculous happens, he's not gonna get
Yeah.
better.
Yeah.
Okay. But you would keep him comfortable.
Yes, ma'am. And I'm gonna sit down
Okay.
with y'all for like
Okay.
10-15 minutes. All the
Okay.
questions, I'm
Yes,
just trying to
sir.
get through it for
Best
him.
friends
I
and
think
they
that's
come
it.
through,
Yeah,
so-
I think
I'm
that-
Dr. Das.
Okay,
You have to-
Thank you.
Thank
I
you.
just
Nice
figured you had
talking
other
to you.
places.
Thank
Yeah, so
So-
y'all wanna like come over here and.
My question also is, Troy can be fairly combative.
Uh-huh.
What happens if he gets to hospice and he starts pitching a fit? What do they do?
It happens all the time.
Oh, back there over there.
We've got medications for that.
Okay, so they would sedate him.
Well, they would get, I don't wanna call it sedating, but yes, they would relax him. If he was being combative, and then they would wean him off of it, see if he needs it.
Did they do any kind of restraints or anything?
They don't like to do restraints. If the person is falling out of
I mean,
bed
he
a lot.
wants to go home and he will get
Yeah.
up. And I think he would try to get up and go.
Where would the hospice be?
Were y'all given a list of nursing homes?
Yeah.
Sheila gave me a list of,
Okay.
One of
but
them was
what she
Garden
gave me
Farm.
was for,
For nursing homes. So that's what I was it's, a lot of people can get confused between skilled facilities and nursing homes. Every nursing home, pretty much, is a skilled nursing facility.
Okay.
And by that, that means it's not an assisted living.
Yeah.
You can have your assisted where you take care of yourself. There may be nurses like down the hallway, across the field, whatever. Once you get skilled, there's nurses stations throughout the entire facility.
Mm-hmm.
Let's use Garden Park, for example.
They have hospice.
They do not have hospice.
Okay.
We are hospice. So hospice goes into any nursing home.
I got you. So they just provide the bed and the
They provide, and the nursing care.
nursing care.
So I'm going to start it from the beginning, just so that way I can answer any question, because sometimes when I go like this, I feel like I forget to say things.
Right.
So once it is determined which nursing home, I'm just going to call it a nursing home, for lack of a better term.
She's looking at Garden Park for us.
Okay, and I highly recommend Garden Park.
Okay.
It's actually one of the facilities I call on,
Okay.
and it's my favorite.
Okay.
Very good nursing staff, very good director of nursing, immaculate. It's a really nice
We've
place.
had several friends there.
Yeah.
So it would be if they have a bed.
Yes. Now, what is his insurance right now?
He has Blue Cross Advantage.
It's LA Blue Advantage, PPO.
It's
It's Medicare Advantage type.
But no
thing.
Medicaid or anything like that?
no.
Has anybody talked to y'all about nursing homes and how much they cost? And
Well, my insurance, I thought, paid the first 100 days.
Hospice.
you're thinking of skilled.
No, it said hospice. It pays. The hospice.
Okay, well maybe it does. Usually, sometimes they'll say that, but it
100% in
Okay.
network.
Well, it said it may not cover some of the medications.
Okay.
Well, and we can have our res cycle run that to see
Mm-hmm.
what it is. The reason I was asking you is because if they're on Medicaid, Medicaid pays for all of it.
Yeah.
Like Medicaid pays for all your room and board, and
Mhm.
then hospice, Medicare pays for the hospice part of it. So your Medicaid, they're like,
Yeah.
it's frustrating.
Our insurance changed on April 1st.
Mm-hmm.
We had Medicare primary,
Mm-hmm.
Blue Cross secondary.
Mhm.
Now it's called Medicare
Now it's
Advantage.
LA Blue
It's a school board.
together.
That's good though. I mean, those are two good insurances to have. I mean, Medicare
Yeah.
and Blue Cross.
It's through the school board. It's
Yeah.
Louisiana Advantage,
Okay.
Blue Advantage, or something like that.
So first thing is he's got to be accepted somewhere, and I'm gonna go talk to Sheila, the case manager,
Yeah.
after this. That's the first step. Then once he's been accepted, prepare yourself. The hospital's gonna be like,
Yeah.
because
They want to hurry up and get it.
well, it's all about
Availability for other patients and
that, and just like it doesn't look good for a patient to die on your watch.
Right.
They know they're gonna pass away on ours, so we kind of take the brunt of that. It's just how it is. I mean, if they've got somebody that
If
can,
they have a room, then we need to go ahead.
so we would, once they get them accepted, that will move quickly.
Be a day or two.
A day, maybe. Maybe, it could be that same day.
Okay.
Once they've been accepted, then we kick into gear and we find out from the nurses, like what medical equipment he needs. Every nursing home provides different levels of equipment. Every patient has different things that they need.
Mhm.
Some need a walker, some need a wheelchair, some need oxygen, and we figure all that out. Y'all don't
Okay.
have to worry about any of that. We make sure that all that stuff is delivered to his room before he is discharged,
Okay.
because we don't like for that transition to happen. There have been a couple of instances, I'm going to tell y'all this, where the nurses here didn't let us know that the patient had been discharged, and we had to scramble, because Garden Park is very, 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 not, I don't even want to call it picky, I think it's great. They want that nurse there ready to do that admission
Yeah.
when the patient rolls in the door. So we've had a couple at Garden Park. Luckily, we had a nurse that was able to get there and do it right away. But
So, is there any PT or anything when they're in hospice? Probably not, huh?
you can do a little PT, but it's really just for
Making him comfortable.
safety issues. Like if he's somebody that was going to be transferring in and out of his bed and walking to the bathroom, then yes, we would. But if that's not the case, so right now he's kind of in a weird set because he's not going to be able to be skilled, which is, I like to call it, rehabilitated. Just and the problem is that once they get skilled, if they don't show any improvement, then they kick them out.
We've gone from Dr. Alexander
He's one of our
Last
medical
week-
directors.
I know, well, last week, it was like, oh, he needs to go to hospice and y'all need to make a decision, and then she had to go home thinking this, and he chased her down, making sure she was gonna make this decision, and then all of a sudden, he's doing better, and then, of course, Dr. Dice is saying, no, he's really not doing well, so we're
It's
kinda-
been,
You see how,
Well, but
I need to
that's-
prepare my mind.
Here's the
It's
deal, that's
confusing.
just,
it's confusing.
it's life, it's not even them confusing you, they're going by the things they're telling y'all is what they're seeing, and things change every day. You know, you can have really good days and really bad days. I mean, we have patients that are doing great, and then the next day, all they want to do is sleep. The next day, they're up moving around. You know, so it's every patient is different.
So do you remember what he was saying, why he's in a situation where he's not gonna get better?
Well, it sounds like his kidneys are
The
misfunctioning.
kidneys are the biggest thing.
It sounds like he's
Okay,
got
and it's
like some brain
sepsis, they said?
sepsis, which is
Okay.
just, you know,
Confused.
well, sepsis is bacterial infection.
Right.
And when they call it septic, that means it's not just located in one place,
Right.
it's all over. Doesn't help with
He
with
had
the,
ketoacidosis, and I know
Mhm.
that
so he's
probably,
had multiple comorbidities.
yeah.
Did he have any underlying issues before this? Like, I don't even know why he came
He's
into
a
the
type
hospital.
1 diabetic.
Okay,
Well,
No,
he
he,
kept falling and,
okay, so he was kind
Had some
of
cognitive
starting
stuff,
to
He was
digress a
starting
little
to
bit.
decline.
Okay,
He drank some alcohol.
yeah, he had a fall and busted
He's
his
fallen
head.
3 times in the past 3 weeks.
yeah. Does he still drink?
Yeah,
Is that part of it, you
Yeah.
think, is that he's drinking?
yeah.
Yeah, well, we would get a hospital bed, and then we would also put like another mattress next to the bed. It's called a fall bed, fall mattress. Has he tried to get out when there's bed
No,
rails and
He's
all that?
wanting to get out.
Right.
He's one, but he hasn't tried.
Well, and it's just gonna be something, we'll let the nurses know, it may need to be something where he's closer to the nurses station. We'll tell him about all that.
Yeah,
I do want to be honest with him and tell him what he's doing, because I don't want, if they don't have the number of nurses to take care of him, I don't
Right.
want that to affect
Right,
him.
right.
So I can talk to the director of nursing there. I mean, I talked to.
I think it's been 2 days, 3 days ago that he tried to get up
Well, and you're gonna
one
find.
morning and they tried to stop him and he kicked back at him and,
Yeah.
you know.
Yeah, you're gonna find too, if he's not eating any, that,
He's not eating,
yeah, a lot of that is, he'll start not having enough energy to get up out of bed,
yeah. Right.
you know.
He wouldn't be able to walk right now anyway because he's so weak, I'm sure. But the not eating, well, the nutrition he's getting should keep his organs from failing, I guess, at this point, or maybe not.
I mean,
Not
IV
getting
fluids are just kind of palliative, they're
Okay.
keeping his electrolytes going and that sort of stuff. You know, if he's not getting a peg tube, which we wouldn't do a peg tube anyway, I mean, peg tubes are not meant to be continuous, they're just.
Yeah, and that's what the doctor said, it's open to infection. and
But
all
he
kinds of
could
things.
get better too. I mean, he's just been out of the ICU a few days. I mean, people can rally.
Yeah.
I mean, you would be surprised, the patients that.
But if he's in hospice, can he rally?
Yeah,
I mean,
hospice is there just to create comfort. We're not there to treat, and by that I mean we're not there to fix things. As in, like, if you had a tumor, we're not there to do
Right,
chemotherapy
right.
on you. I mean, But no, we're there to keep you comfortable, and if he wants to eat, we absolutely want him to eat.
Okay.
You know, as long as did they do a swallowing test
they
on him?
did.
And they found him to be at risk for
They
choking?
did it first, but then he kept wanting water, and he starved water, and he drank like 2 pitchers of
Okay.
water in one day, so it was like, I don't
And
know
then
why
that
it's
now,
not
all of a sudden now, well, no, there's an issue again.
Well, I wonder, I'm have to see what came back on the swallow test. Because that's what you don't want, is for him.
to aspirate, yeah.
No, but then that's like, but if they're not eating,
Right.
then it expedites one thing, and,
So I'm not gonna be able to get in my mind, he's gonna get better or he's gonna die. It's gonna be, I'm not gonna know that.
you would probably know pretty soon. You would probably know without him eating or drinking anything. You would, and the nurses at Garden Park, if that's where he goes, are very, very good at recognizing things. Right now his creatinine is not that bad, so he's got that going for him. I mean, it's just gonna take time one way or the other. And he's either gonna,
So hospice is not an end. I guess it could be an end, but it's not an end of itself.
it usually is an end, but it doesn't have to be an end.
Okay.
We've got plenty of patients that we admit to hospice, and then we legally, after I think 3 months or 6 months, have to go back in and do a recertification to say, yes, this patient is still eligible. We've got patients we have to discharge all the time because they improve so much. They actually tend to improve more on hospice than not.
Do they improve to the degree that they go back to the hospital?
No, they like, a lot of these patients are at home in a nursing home, and, you know, we keep waiting, and they're doing fine, and yeah, we have to discharge them, meaning we have to take them off of our
They
service.
have to be able to walk and, you know, that, I mean, cause those, she can't, he'd have to go home to her,
Yeah.
home, to a.
Well, no, he would stay in a nursing home. I mean, like,
He would transition from
In other
hospice
words,
to
there's
nursing
no
care.
real way he's gonna go home.
he could go home tomorrow,
But she doesn't
but y'all
have to.
can't, right. So, I mean, that's the reason we're having to find a facility for him, because you're unable to take care of him.
Yeah.
You
I
can't combat him, and you don't need the stress. You're supposed to be his family, not his caregiver at this point. And so that's another good thing that hospice does, is we try to alleviate a lot of that
Mhm.
caregiving that y'all feel like y'all have to do.
So if we say now, we feel like hospice is the way we want to go, what's the next step?
Right, so we'll get him accepted to a facility. Like I said, it'll start moving fast. I'm gonna go ahead and just
You
get,
work with Sheila on this? Okay.
oh yeah, there's a guy named Chris. Have y'all met Chris
Yeah,
already?
we met Chris.
Chris and I are coworkers.
Okay.
So
And he
he's,
mentioned that if they go into a facility that he follows them or somebody different.
our nurses do.
His
He
nurses
wouldn't,
fine.
he and I stay, I go out to the facilities a little bit, but,
He has people under that follow.
well, yeah, they're just nurses that just, I mean, he's a nurse that does all the jobs
Okay.
here in the hospital, and we've got nurses that do it out in the community.
Okay.
He just doesn't go out to the community very much because this hospital
And
keeps
how
us
often do the
busy.
nurses check on them?
Depending upon the acuity of the patient, it can be anywhere from 3 days a week to 7 days a week.
Oh.
We have a system called Muse. And it's kind of strange. It's actually like medical artificial intelligence, but the nurses, every single time they see a patient, they have to put in all their findings, and it immediately calculates how often those nurses need to be going. It's pretty cool, and it is always spot on.
Are there nurses from the nursing home though that would take care of him when your folks don't?
That's what I was saying. When they're in a nursing home, you're going to have, we call them touches, like how many times the patient gets touched by a clinical
Mhm.
person. He's going to have twice as many.
Okay.
He's going to have their nurses and aides and our nurses and aides. Our aides come in too. And we alternate that on the days.
And he cannot check himself out of this?
You mean check himself out of the nursing home facility?
Yes.
No, I would say, I mean, he's not decisional right now. In fact, you're probably going to have to sign off on the paperwork for the hospice admission.
Okay.
No, and those doors are locked. They can't get out. We can't
Well, I
even
mean,
get
he
out.
couldn't walk and begin with.
Yeah, I wouldn't, that would,
But if he tries.
I mean,
to get up
if they start seeing they're having problems with him getting out of bed, they would call us.
Mhm.
We would talk to our medical director. He would say increase the Ativan or the whatever,
Okay.
depending on what it is he wants to use,
Okay.
so that he's not doing that.
Okay, well, let's move in that direction. So,
Okay. Let me, I just give this to y'all just so it's something for y'all to have. This is just a little pamphlet.
Okay.
If you're bored, y'all can read it.
Okay.
I don't imagine you will be. And then I've got a card too. Let me-
Now, who's gonna call me and tell me, for the next 60 days you pay nothing, and after that you pay $2,400 a week?
I'm gonna talk to Jamie, our admissions coordinator,
Okay.
and see if she can figure that out. I think they're gonna figure out a lot of that before he's even accepted. So Sheila is working with case management.
She'll be able to tell me that.
They're running all the numbers. We just step in when they say he's been accepted, he's going on hospital services. We figure that it's been figured out.
Okay.
And then Medicare will pay for all of all of the things hospice. Every medication Medicare pays for, all his equipment, everything. There's not a bill that comes from hospice. And if you do get a bill, you just throw it away.
Okay, so how long does it take to get all that done?
The admitting to the facility.
Yeah.
I'm gonna go check with Sheila. I'm gonna see where she is on it. Do you know where else? Did y'all give other names other than just Garden
She
Park?
had a few on
She was checking a few, she highlighted some.
Okay. Well, I'm gonna go talk
But
to her.
I'm sure they're all y'all's.
We I mean, there's a
facilities.
couple that we don't have contracts with, just because a lot of the facilities they've got a medical director for the facility that's also a medical director for his hospice.
Okay,
So but yeah, it's kind of medically unethical.
okay.
Nobody's gonna scream foul on it, but Garden Park is not that way
Okay.
at all. I mean, we have patients there all the
So
time.
if they have an opening.
Yeah, I'm gonna go talk to Sheila and I'm gonna come right back and talk to y'all.
Do we sit here?
You know what? She's in a meeting, but she'll be out in 15 minutes. No, we all can go in there because I've got to hunt her down.
Okay.
Thank
Thank
you.
you.
Oh, sure.
And what's your first name?
Ellen.
Ellen, okay.
It's Ellen Alley.
Is there a situation, Ellen?
That's okay.
Ellen, would there be a situation where I need to contact you?
I can be a good point of contact
Yeah.
until he is
I'm sorry, hon.
discharged from here.
Mhm.
I'm usually pretty good about finding y'all and answering questions.
Excuse me just a second. Barbara, back me this way and back
I'm
me out.
trying to.
No,
I
back
don't
me
wanna
out.
run over the lady.
No,
That's
no,
all.
no, no, let me do it. Let's see if I
These
can.
things are so big and full.
Yeah, they are. What happened to your leg, by the way?
I got,
She did surgery 8 times and 3 infections and they
yeah,
finally
I
said,
had
this is it.
hospital infections that couldn't be fixed. They've done everything they can do. I've been to Baylor,
Oh my goodness.
so there's nothing they could do, so they took it off.
When was that?
That was about a week and a half ago.
Oh my god.
Yeah, so she was no.
So I can't take care of anybody right now.
No, I would say not. That's a lot that's been going on for you.
Yeah. But I can take care of myself.
Plus you're in rehab and all this happened, but
Yeah.
I got it, Sheila.
it was a mess.
Okay, so I'll be back. I'm gonna go hunt. They're in a meeting every day from 1 to 2.
I'll turn around right here just for a second.
I'll be back. Okay.
Okay.
Okay, I'm gonna get it. Hang on.
Barb's got it.
Yep.
Hey, how you doing?
I'm the Uber driver.
Good.
Emily.
Why don't you put that with that other paper that